session. I know that there's a lot more to an acupuncture or to a traditional Chinese medicine session than just acupuncture.
Right.
What are some other things that a client could experience during that time?
Sure. Well, we might use cupping, which is where we take glass jars and we basically use a flame to suck all the oxygen out of it to create some suction, which we then put that cup down on somebody's back or a problem area. So you might have cupping. Cupping is most commonly used for pain, muscle pain of some kind, or joint pain. So you might have upper back pain, you might have low back pain, knee pain, shoulder pain. Any of those are very common uses for cupping. And what cupping does is it basically creates a suction over an area. So you can actually get deeper into the soft tissue than you could if you were just doing like massage per se.
Okay.
Because you can actually, doing the suction actually can pull some congested blood from deep within the tissue and can pull some of that inflammation closer to the surface so that then new blood can rush in and can heal up the affected area. I'll also use cupping for more unusual indications, like if somebody has allergies, for instance. I will use cupping to help stimulate their immune system. We might use moxibustion, which is, moxibustion breaks down as burning moxa, which is where you take dried mugwort and you'll use that to warm up specific acupuncture points or specific parts of the body if somebody's experiencing cold or has cold lodged somewhere. We might do some ear acupuncture, some ear seeds. So we might send somebody home with seeds taped to their ear, magnets taped to their ear that they can stimulate on their own once they're home. We might also do some electroacupuncture, which is where we apply electrical stimulation to the needles. And that's not something that I use a lot of, but occasionally we'll use that if somebody has a really deep-seated issue that doesn't respond well to acupuncture right away. And then we might also use a little bit of Tuominen massage, which is a very great form of massage. It's a precursor to shiatsu.
Oh, okay.
And then as part of that, we'll also talk about food therapy. That's an important part of my practice. And then also herbal medicine. I might prescribe herbs that somebody can use to basically to help them bring their body back to balance faster. So I find that when people use herbal medicine, that they're able to treat themselves every day, a couple times a day. And so they heal faster, and it's much more efficient and much more cost effective. And so I'll use that with a lot of my patients.
So how do herbs work? I mean, a lot of people kind of like, oh, why would I take, a piece of grass or whatever it is? People have a lot of different ideas about what herbs are. Tell us a little bit about it.
I think herbs are the greatest invention ever, personally. And in fact, if the herbal masters from, the classics were to look at the way that we prescribe modern medications, they would just laugh at how archaic it is. I mean, why would you take one tiny, tiny little chemical, blow it up into a huge, huge amount, and then ingest it? Like, of course you're going to have side effects. Of course you're going to have problems. Like, that's like eating just one food for the rest of your life and never eating anything else. I mean, that is going to throw your body off. And the Chinese were all about finding balance. So what herbal medicine is doing is it's trying to gently bring your body back to balance by healing the root of a problem. And so we very rarely give somebody one single herb. So even though one herb will have 200 active components to it, we very rarely give them one herb. We usually give them a formula of herbs where we have 4 to 15 herbs that are part of that formula. So you have like your chief herb that's going to be doing the bulk of the work, and then you have other herbs that are added to that to both help that herb do the work that it needs to do and maybe mitigate some of the side effects that might occur. So you basically end up with this very well-balanced formula that will help bring your body to balance.
How does acupuncture actually work?
The traditional Chinese medicine explanation for acupuncture is that what you're doing is you're trying to stimulate the body's qi or energy, and you're trying to rebalance it. So if you don't have enough energy in your gut, it will bring more energy there. Or if you have a blockage in your gut, maybe you're constipated or you have a lot of indigestion, it'll try to pull some of that away from your digestion so that things can move more smoothly. So the acupuncture points are found along specific meridians. So we have just a little meridian model here. You might be able to see the lines that are on that connect everything in the body. So for instance, the stomach meridian starts up by the eye and it travels down through the digestion and then out the outside of the leg and down between the second and the third toe. And so you can use points to help the stomach by, doing acupuncture on that, over the stomach and on that stomach meridian. But you can also do acupuncture lower on the leg and the stomach meridian, and that will actually travel up and affect the digestive tract.
Wow.
So we're really looking at the acupuncture points as being points on the meridians where you can actually tap into what's happening in the energy of the body. The and I mean, the biomedical explanation for it is yet to be determined. They're still trying to do a lot of basic research to understand how acupuncture works. But some of the recent research that's been coming out has been looking really at the connective tissue of the body, and I think that's where the key is, because connective tissue covers absolutely everything in your body. It's the base layer of all of your skin. It surrounds each muscle fiber and each muscle group. It surrounds all of your bones. All of your blood vessels are made out of connective tissue. It plays an important role with your nervous system and with your brain and everything. And so if you were to take away everything else in the body and you left just the connective tissue, you could see every single part of the body. You could see all of the organs, all of the vessels, all of where everything kind of travels through the body. So what the acupuncture does is it actually can adjust that connective tissue. So if the connective tissue is too tight, where it's impeding circulation, or it's impeding nerve signals, or it's impeding the movement of an organ, you can loosen that up. So you can increase circulation to that area. You can loosen up that organ. So if you're constipated, you can loosen up the intestines so that they'll flow more smoothly. Or if things are too loose, you can tighten them up. So I think the key is they're really gonna find that it's in the connective tissue of the body.
Wow, that's really, really fascinating.
I know, it's really cool.
And the question on everyone's mind, do the needles hurt?
Acupuncture does not hurt.
Okay.
Generally, when somebody gets acupuncture for the first time, you might, when a needle is inserted, you might feel a little bit of a prick, almost like a pencil poking you, or maybe even a mosquito bite. That isn't necessarily even the case, though. And then once the needles are in, a lot of times people won't feel anything. They'll just feel very, very relaxed. Other times, at specific points, you might feel a little bit of an aching or a heaviness, but that's actually a good sign. That's a sign that we're stimulating the connective tissue the way that we want to, and we're adjusting the chi, or the energy, the way that we want to. And I would say that the most common side effect of acupuncture is that people feel really relaxed. So, when people get off the table, they're like, wow.
Can't complain about that.
Exactly. They're like, I slept so good after my treatment, and it's pretty awesome.
Oh,
So
you talked about the meridians before. How did the Chinese figure that out? Because these aren't energetic pathways. These aren't pathways that you can X-ray and see. These are not. It's not the nervous system. It's something completely different.
Right. And now, see, having been an engineer, I'm skeptical of everything. So I don't believe anything the first time I hear it. I'm always like, I need some proof. So I was always a little bit hesitant about the meridian theory until I did have an experience one day that just really cemented it for me. And that was that I was treating myself for some digestive issues and did some points on the stomach channel. And when I did that, and when I was stimulating the needle the way that I needed to, I could feel a sensation travel from my stomach down the outside of my leg, down that stomach channel. And that was when I was like, okay, there is something to this. There is, these pathways do exist in some form. And they've started to do research too on specific points to see what the properties are of those points. And they found that there's actually increased electrical conductivity at specific acupuncture points. And as you get further away from those points, you actually get less conductivity. So there are some electrical components or characteristics of those points. For instance, this channel where you can help with nausea, that channel travels up through the chest and down into the stomach, according to the meridian charts. Same with this point that helps with headaches. It travels up the arm and across the front of the face.
Huh. Wow. Yeah. So it's just so funny. That's one of the things about acupuncture, reflexology, and a lot of things with Chinese medicine. It's just how this doesn't seem like it's connected to your head.
Right? Yeah, exactly.
What you rub that for what? And you're So I mean, it's absolutely fascinating how it works, and you have to sort of see it to believe it. Do people kind of seek out acupuncture as sort of a last resort? Gosh, I've tried everything and nothing's worked. I'm heading here. It seems like a lot of holistic and alternative and complementary practitioners are finding that. They'll go through the Western medical community, they go to their doctor, they just can't get the relief, and so they're like, I don't know what else to do. I'm going to just try this crazy stuff that someone told me about. I mean, do you find that a lot with your clients, or do you?
Yeah, I would say probably 50% of my clients are at that stage where they're like, I just tried everything that Western medicine had to offer, and I just want to do something else. So, I'll get a lot of people who are coming to me because they want to get off of a medication, or because they want to prevent going on a medication, which basically means they tried Western medicine and it's not working, so they want to try something different. Otherwise, the other 50% of people are those who really, really care about their health. So they're coming in to manage their lifestyle and, you know, their food and, you know, taking care of some of these just really, you know, important quality of life issues. So I actually get, you know, I see a lot of people who just really care so much about their health that that's why they're coming in.
Have you ever experienced that acupuncture might not be the right path for someone, or have worked with someone, or are there particular issues that you find that acupuncture may not be the best fit for? Or
Yeah, and sometimes that can be that I'm not quite the right practitioner for them, and sometimes it's that Chinese medicine isn't the right thing to address the problem. I've worked with a couple of people where they haven't responded very well to acupuncture. In those cases, it's generally been because there was something in their life that was really blocking the effects. Like, for instance, I was working with somebody who had a very severe digestive issue, but who was drinking a lot of alcohol almost every day. So there's only so much that I can do with natural remedies, with natural herbs and acupuncture, but if you're overriding all of that with toxins every single day, I'm pretty limited in what I can do in those cases.
So you really need the patient's collaboration with you in order to make it a success.
In some of those severe cases, yes. But there are plenty of other cases where somebody's like, you know what, I'm not changing my diet, I'm not changing my lifestyle. It's like, okay, well, we'll still do everything that we can and we'll still have plenty of success. And sometimes your body is so out of balance that there's no amount of like eating perfectly and exercising and sleeping right that's going to help you come back to balance. Like, you might need to do something physically, like you might need to use some sort of treatment therapy to help your body get back to balance because it's just so far out from center. So for instance, where I'm not quite the right practitioner, if somebody is trying to, you know, manage really, really severe diabetes or something, I'll usually refer that to usually to a more experienced practitioner, meaning somebody who's more experienced in those areas, since that's not something
More
I
specialized.
deal. Right, they're more specialized in that.
That leads to another question that I have. What would you recommend to our audience that they look for when they're looking for a practitioner for a traditional, what's the long version of what
Traditional Chinese medicine practitioner.
Traditional Chinese medicine practitioner. If someone is looking for one of those, what kinds of criteria should they be paying attention to?
Well, the first thing that you want to look for is you want to look for somebody who's a licensed acupuncturist. So that will mean that they're licensed by the Minnesota Board of Medical Practice. So you want to look for somebody whose credentials are L.AC, licensed acupuncturist.
Okay.
That's going to be somebody who's had 3,000 hours or more of training in traditional Chinese medicine. And then I think it's, if you're really looking for somebody who will help with herbal medicine as well, since that's something that I think is very important and a very great complement with Chinese medicine, and is actually practiced. In China, they use herbs more than they use acupuncture.
Oh, wow, okay.
Right, so here it's more acupuncture heavy because people are more familiar with that, but in China it is more herbs. Then you want to look for somebody who either is a diplomate in Chinese herbology or a diplomate in Oriental medicine, which means that they have both they're both a diplomate in acupuncture and Chinese herbology.
Well, thank you so much, Senia. This has been absolutely fantastic. We've had the demonstration of the acupuncture sessions. We've had all sorts of information that you've given us, and this is just an amazing summary of what people can really expect from an acupuncture session. Is there anything that you'd like to send people away with today, or any last words that you think people should know before they go on their own and look for an acupuncturist, or if they're...
Well, I would say that if acupuncture is something that you're considering, or if Chinese medicine is something that you're very interested in, then I encourage you to explore it some more and try it out for yourself, because the results are really amazing, and I think you'll be pleasantly surprised.
Thank you very much.
Yes, thanks for having me.
Wonderful having you.